You're part of this ENT and allergy group. You see signs in your office. I got a magazine. What is that all about?
ENT and Allergy Associates is a large group, in fact the largest group I think in the country, of ear, nose, and throat specialists and allergy specialists. We have about 25 offices throughout the tri-state area, and it's about between 75 and 80 physicians. It's just a group that is managed in Westchester by a group of business people who have learned the way of running offices properly and dealing with insurance companies. And the benefit to those of us who work in this group is that I am a physician and a physician only. I spent 12 years in academics and never learned how to run an office myself, and thankfully I still don't have to. I have people who will run it for me. What that means is I spend my day seeing patients and taking care of patients. I do not deal at all with the business end of things. I have other people who do it for me. And so for those of us who work here, we find it's a benefit. We do not have to spend extra time dealing with businesses. Most of us are not good businessmen. In fact, physicians tend to be
It's
very
like a
poor
group without walls?
Essentially, a group without walls. However, there is the one corporate office up in Westchester.
A central thing.
A central that does all the billing, deals with the insurance, deals making sure that we have all of our certifications up to date, that we've got our DEAs and made sure that we have our registration update. And they sort of remind us, and they also run the office. They supply us with all the personnel for the office. They train the employees before they actually enter the office, so that when someone is sick and we need someone else to replace them, they take care of that. When someone quits or is fired, they take care of replacing them, providing us with the infrastructure.
So in other words, let you become a doctor again and not a businessman.
That's the idea. In truth, unfortunately, I am a very poor businessman. I think I'm a good doctor, but a poor businessman, so I'm happy to let them do the business and let me do the doctoring.
So you're a doctor first and a businessman second is the way it should be, is that correct?
Right. I'm actually a doctor first and a businessman not at all, but some people are businessmen second.
So actually you went into the medicine for the right reasons.
I like to think so. Unfortunately, there are certainly external circumstances that have forced doctors to become businessmen. In this group, we found other people to be the businessmen for us, and so it's allowing us again to become doctors and doctors only.
It seems that's going to be the future model for a lot of things. I'm a pediatrician, and there's a big group in Long Island that got together, 55 pediatricians, and they're talking about doing that in Brooklyn and Staten Island with a bunch of pediatricians. It seems to make sense, and maybe
I think it works
your
well.
experience is a good one.
My experience has been good. Again, I came from a different experience. I was in an academic center for 12 years, and so it was very different. Again, I had a hospital managing the office. Unfortunately, hospitals tend to manage offices poorly. Here we have a group that's managing the office and managing the business aspect of things, but they're managing it well. I think also there's strength in numbers. We have ability to negotiate with the insurance companies who really are not out to help patients. They're out to restrict care because that's the way they make bigger profits. They make bigger profits. The CEOs of these managed care companies are getting bonuses in the hundreds of millions of dollars, and they're doing that based on restricting care and making it difficult for doctors to get reimbursed, and for doctors, as I mentioned before, to give the kind of care they want. If I want to give a certain antibiotic, sometimes the patient can't afford that antibiotic if that antibiotic is not on the insurance company's panel, and therefore the insurance company is either not going to pay or going to pay a very small percentage of it. And sometimes the expense to the patient is prohibitive, so they cannot get the antibiotic that I would prefer to give them. And this is a problem, and so as we work in bigger groups, we're able to handle the managed care companies a little bit more effectively.
So in other words, you're a doctor now.
I am.
And what I've seen and what I've heard about that particular group has been very favorable. And I think it's the model down the road.
I think it is. I think the idea is to have good business people behind you who understand that doctors have to be doctors. One thing I will say that I was concerned about when I left my academic practice was, are business people going to be telling me how to practice? Are they going to be telling me, well, you need to see more patients or fewer patients, or only this kind of patient or that, or do less surgery or more surgery? And in fact, they've told me nothing about how to practice. They've only aided me in practicing properly, so I've been very happy.
I thank you very much.
Thank you.